Good morning. I'm Dr. Sharon McQuillan, and I would like to thank Dr. Klatz and Dr. Goldman for the opportunity this morning to introduce one of our newer opportunities at the Academy. We have developed an aesthetic fellowship, and this is the first aesthetic medical fellowship in this country. I know elsewhere in the world, aesthetic medicine is considered a legitimate subspecialty, and we are working toward creating that in the United States with this academy. Do we have our slides? Our fellowship with the academy involves intensive hands-on experience so that people can develop clinical competency in aesthetic medical procedures. This is unique. The other thing that is unique about our fellowship is that we offer affiliation with the University of South Florida College of Medicine, and we are adhering to evidence-based medical standards. This again is unique in that most of the aesthetic medical training to date in this country is at least influenced by commercial vendors. And so we're working very, very hard to establish standards and to educate people to those standards, and we would like to invite you to join us in this effort. We're here because we love anti-aging medicine. I know I do. And I think it's the most integrous way to practice medicine. So all of the things that we have learned in anti-aging medicine really apply to aesthetic medicine. They are one and the same. With anti-aging medicine, we utilize our diagnostic capabilities, and we try to treat the root problem to eradicate disease and optimize health. In aesthetic medicine, we really do the same. If you optimize our patients' hormone balance, their antioxidant balance, their immune function, and really improve their health, then as a result of that, they are going to look more attractive. All of our standards in aesthetic medicine are a result of what we view as healthy. So if you can create health in your patients, they will actually look more beautiful and more attractive. So I would encourage you to believe that this is a natural extension of what you are already doing in anti-aging medicine. I think we have viewed them as somewhat separate in the past, and really the skin is the largest organ in the body, and it is susceptible to all of the oxidative stresses and environmental toxins and ravages of hormone decline as the rest of the organs in our system. And really what we are doing in aesthetic medicine as we become more savvy and more knowledgeable is to reverse these physiologic processes that cause changes in our appearance. Your patients that you are currently treating are going to want to achieve or want to have aesthetic services in addition to their anti-aging medical strategies that you provide. And if you are not providing them, they're going to seek them somewhere. And as our space becomes more competitive and more of the mainstream traditional physicians enter our space, I think that you have the risk of losing your patient, or worse, having them have procedures in hands that are not well trained and having adverse events. So your patients really want you to be able to offer these procedures, and all of our studies show that they are comfortable and happy to receive these procedures from physicians that they have a trust relationship with. And who are they going to trust more than their anti-aging physician? We know more about our patients than probably any other medical practitioner. So The demographic of baby boomers want to have both anti-aging medicine to improve their physiology and their function, and as a result of that, and in conjunction with that, we really need to work to help people improve their appearance. People need to have consistency between how they look and how they feel. The aesthetic industry is growing, and it is a very vibrant industry, and it has so far been recession-proof. Aesthetic procedures are going to expand in number through 2012, and I see absolutely no reason why they will not continue to expand beyond that. The aesthetic industry allows us, I think, as anti-aging practitioners, to generate a revenue stream that will enable us to do all of the other things that we want to do in aesthetic medicine. I think, as physicians, we're taught not to think too much about profit, but we do have to pay our bills. We have to keep our practices open. And in anti-aging medicine, what we are actually offering our patients is our time and our expertise. Offering aesthetic procedures allows you to have additional revenue streams that will range between $1,000 to $4,000 per hour, depending on your menu of services. We utilize many strategies, which I'll be happy to discuss with you, and to improve our patients' appearance. And we have advances in technology which allow us to do this in a very safe, reproducible, effective manner in our offices. 83% of the procedures that are done in aesthetic medicine today are office-based. The fellowship is designed to promote excellence and to standardize this field. We're very committed to doing that. Again, we provide a hands-on preceptorship, and we assure you that you will develop clinical competence, and we guarantee that, and we're very committed to that because we want to become the aesthetic source known in this country and around the world.